PAD is what's really called peripheral arterial disease, and it's a type of artery problem specifically in the lower extremities and the legs that can cause lots of issues as far as patients and walking and a change in their ability to function. The majority of the symptoms that we think about are patients that develop pain in their legs, but in actuality that's a very small percentage of the symptoms. The majority of patients that have symptoms, it'll be fatigue or tiredness of their legs. They'll find that they're just not able to walk as far as they could previously, and it's a small number of people that actually have true pain. We have many options to treat patients with PAD. Specifically, historically, we used to have medications, and we would have surgery, which would essentially be bypassing around those blockages. And that was a more invasive route and caused some patients a lot of difficulty. Now we have newer options where we can open up these arteries with catheters, rotor-rooters, so to speak, balloons and stents to help improve the patient, and they can leave the hospital just in a few hours rather than a more invasive type approach with surgery. We have some new therapies for PAD that were just FDA approved within the last few days and the last few weeks, where we're actually able to use a balloon that has a chemical coating, and that chemical coating decreases the chance of the blockage returning in the future. So we'll place the balloon across the blockage, we can open up that balloon and inflate the channel, and then that chemical is deposited to the wall of the artery, which actually stays in the artery and decreases the chance of scar tissue and blockage coming back in the future. So it may be a more longer lasting approach, again in a lesser invasive route of therapy.